Welcome, my guests. My name is Solomon Nzioka, founder and managing director of Phoenix Climate and Health Impact Experts. I introduce Chris, an open source future. Chris is the Climate Health Resilience Intelligence Suite, a future ready modular digital public good designed to close a critical climate health intelligence gap. We propose to do this by coming from the knowledge that climate change is increasingly affecting health, communities, and health systems. Yet decision makers lack integrated, trusted intelligence linking climate risk to health vulnerability and investment. CRIS integrates climate, population, and health systems evidence to generate standardized climate health intelligence products. And as we will see in the methodology, we see CRIS being a layered system where it begins by integrating what is already known and promoted by IPCC, which is the recommendation that vulnerability is a product of exposure, sensitivity, and adaptive capacity. It also builds on the WHO domains as the authority in health systems integration to produce composite indices, and those indices also include epidemiological modifiers to produce one point source of truth, what we are referring to the enhanced vulnerability or the ECVI. It is the ECVI that we load economic models based on economic burden of disease, the direct and indirect cost, to produce the climate and health intelligence products. So that in a nutshell is what CRIS is, a layered vulnerability assessment methodology. And when we already did this during the prototype, we were able to come up with a vulnerability index of all the 47 counties based on curated data from World Bank, the World Development Indicators for Kenya. And we were able to bootstrap that curated data into the different counties based on population profiles. And we can see here is that CRIS follows a governed analytical chain where the basic CVI combines exposure and sensitivity to develop county-specific vulnerabilities. And we can see, for example, for Bungoma, we got a very high enhanced sensitivity of 84% compared to the baseline of 58%. We will see why the 84% is programmatically useful than the 58% in the next presentations. We can do the same for every other county. For example, Elgeyo Marakwet, we were not able to translate that, but for Embu, we got specific numbers. For Garissa, we have numbers, but we're also able now to uh, classify our counties into specific uh, hazards or archetypes of hazards. If we go back to the national systems, we find that every county can be classified into one hazard or the other, from um, flood sensitive areas to hydroclimatic volatile areas to seasonal flooding and stable rainfall profiles. And this is important for planning and for programming, in that you can build specific programs to address vulnerabilities resulting from specific uh, profiles. In that, it makes funding and investments to be focused and to be efficient. We have, yes, the results come from each county, as you can see here. For the country, you can do an average, a total CVI, meaning you can track both national and county data profiles, can be managed through CRIS. For example, here we have a scenario whereby the total baseline vulnerability for the country is 67.4%, And the enhanced vulnerability where we load health systems is 77% uh, for all the 47 counties. And you can also decompose that for each county as you will. And you can track each county contributions just like it is that you can have a class mean and individual students' performances. This goes and on for different counties, and all counties can track through their performances. Uh, the next slide presents the results, our early results, which we are going to build on during this funded period. And the results tells us results that we've just shown uh, based on the ECVI, which is the enhanced vulnerability, we can convert that to economic benefits and economic modules that are useful for investments. And in this scenario where we are decomposing a vulnerability curve for a certain county or for the national within 20 years. And for the first case here, we see investments invested continuously and consistently for 20 years. And the next, and we see the decay curve break-even point is at around 6th year, meaning people have a longer period to suffer in quotes. But when you double that investment, we see that we are able to bend early the decay curve within the first 3 years or 4 years, and it is sustained at low vulnerabilities for longer period, meaning we are able to counter the inherent uh, vulnerabilities that affect communities for a longer period. So within the 20 years, communities enjoy about um, uh, 14 years of low vulnerability, whereas at the first scenario, the communities only enjoy those scenarios from the 17th year of the 20-year window period. That is all what Chris is, and we look forward to a future that governance and decisions could be based on evidence, where Chris becomes the facilitator through an open module. To do this, I have a team, and within the team, we have modelers who are specialized in front end and back end. And we also have public health knowledge management experts and full stack developers within the team, as it can be seen from this organogram. All along, everybody is going to play their part, and that way, we hope we are going to deliver a very comprehensive, open good for Kenya and for the world. Thank you very much, and nice listening to me. Bye.